So 59-year-old man with a history of cancer comes in and he says he has the first headache of his life. I'm worried that there might be cancer in the brain. I asked more questions about the cancer. He says that he was diagnosed over a decade ago. He was treated with chemotherapy and he's been in remission for about a decade now. He's had lymphoma in the past. Lymphoma is a cancer that can recur and it can metastasize to the brain. And I'm worried that this cancer might have metastasized to the brain. And if it did, cancer is a tricky little mechanism. It's a tricky thing to deal with because if it started somewhere else and then it's metastasizing to the brain, that means it's spreading to the brain, and it doesn't just spread to one area. It can spread throughout the brain. It can cause multiple symptoms. He could have decreased strength. He could have decreased sensation. He could have changes in his vision. And ultimately, it can affect areas of the brain that he uses for breathing, for survival. Metastasis to the brain is not a great thing, and he could die. So we need to figure out what is causing this first headache and treat it. And if it is metastases, we want to treat it before it keeps spreading to other areas. He says that the headache started 3 weeks ago. It's been constant, but he localizes it. He says that it's only on the left front and side of his head. He says that it also gets worse when he's chewing on the left side. When he's chewing, the left part of his jaw gets more painful. And the most concerning, he says that he's been having decreased vision. In his left eye, he can't see as much. With all of these things, alarm bells are going off. I need to work him up and figure out what's going on. Because if he can't see out of his left eye, I'm worried he might lose vision, complete vision in his left eye. So a lot of the things that he has told me are very concerning. First headache of his life, there is fever, there is weight loss. All of those make me worry that this could be cancer, but I can't anchor. I can't throw the anchor over the ship and stay there. As a doctor, I need to think through everything that he's told me. He's also told me that he's having vision changes in the left eye, and that when he chews, his left jaw starts to hurt. Those don't quite fit with cancer, so it could be something else. I need to keep doing my exam to figure out what exactly this could be. So on exam, he looks uncomfortable. He looks thin, but he's breathing on room air. His heart rate is within normal limits. His blood pressure is a little bit elevated. He does have a history of hypertension or elevated blood pressure. And overall, he looks slightly uncomfortable. On my neuro exam, for mental status, he's awake, he's alert, he knows his name, where he is, why he's here, and he can tell me the exact date. He's able to follow commands, he can cross the midline following those commands, and his language is intact. So what gets interesting are the cranial nerves. When I test vision, or specifically the optic nerve, I notice that on the right side, his vision is intact. He can count my fingers, he can tell me colors, but when I test his left eye, he can't tell me how many fingers I'm holding up. All he can do is tell me if my hand is moving. That is very concerning that he indeed has vision loss. What's also really interesting is that when I look at the cranial nerves, and specifically the pupil's reaction to light, I see a telltale sign. When I put the light in the right eye, it constricts. When I put it in the left eye, it constricts. What's interesting is that when I swing the light from the right eye to the left eye, it dilates. That's abnormal. We call that an afferent pupillary defect. And that tells me that there is something wrong with his left optic nerve. Furthermore, when I look at the back of his eye with a fundoscope, I see that the right eye has a sharp disc, it's clear. But when I look on the left eye, I see that it is enlarged or swollen and it is pale. These are all signs that there is not enough blood flow going to the left optic nerve. For the rest of his cranial nerves, those are intact. When I do his motor strength exam, he has full strength in both his arms and his legs, and I don't observe any abnormal movements. Sensation to light touch is also intact in his arms and his legs, and finger, nose, finger, heel, shin for coordination, intact, and he can walk. He has a normal gait. His arm swing is symmetric. Gait is intact. So now that I have the history and physical exam, I need to figure out where do I localize this to within the nervous system and what is on my differential diagnosis list. What are the most scary things that I can't miss and what could this be? Based on what he told me about having decreased vision in the left eye, and on my exam, I saw that the left optic nerve was pale and enlarged, and when he chews, he has pain in the left jaw area, I'm worried that there is some type of vessel inflammation or decreased blood flow to the vessels, or giant cell arteritis based on his age. This is a very scary diagnosis. If we don't act fast, within hours, he could lose complete vision on his left eye. So let's do the workup. I am worried that there's inflammation, so I'm going to send inflammatory markers in our blood work, specifically ESR and CRP. Both of those came back extremely elevated, making me even more concerned that this could be giant cell arteritis or GCA. My physical exam also leads me away from cancer because typically in cancer, I wouldn't see those optic nerve changes. So overall, with his presenting symptoms, his physical exam, and the lab work, I'm very worried that this could be an inflammation of the vessels. And when you have inflammation of the vessels, what's happening throughout the central nervous system is that there could be decreased blood flow to specific areas. And if there's decreased blood flow, that's called ischemia. And yes, that area can die over time. And there are multiple vessels being affected because we're also seeing that with his jaw claudication, or when he chews, he's having pain there as well. So what we want to do is act quickly. We want to prevent further vision loss, and importantly, what we want to do is prevent his right eye from starting to lose vision. So for our patient, we started high-dose steroids. We wanted to target that inflammation. And after starting the steroids, his headache went away after a few days. The jaw claudication, that also started to improve. Unfortunately, we weren't able to regain any of the vision that was lost out of his left eye. So he could only see motion, finger motion in his left eye. But importantly, there was no vision changes of his right eye. We were able to catch this very quickly and prevent further vision loss, and we were able to save all vision in his right eye.